Group Health North has been serving benefit clients since the early 90s, working with all sizes of companies and in every industry. We're happy to bring you this video to explain the details of your new group benefit plan effective April 1st, 2020. Note, all rights to benefits are governed by the group contract. Any discrepancies between this presentation and the group contract, the terms and provisions of the group contract will prevail. There will be a list of contacts provided at the end of the presentation to assist you with any remaining questions. Employee life insurance pays directly to your named beneficiary, tax-free, when you pass away. It is important to remember to keep your beneficiary up to date. By not assigning a person as beneficiary, it means that the life insurance money will automatically go to your estate, leaving it subject to government taxes and probate fees. By listing a person as your beneficiary, they will receive 100% of their life insurance tax-free. Your policy provides you with accidental death and dismemberment benefit, also known as AD&D. The accidental death pays your beneficiary in the event that you pass away in an accident, both your life insurance and your accidental death benefit. The dismemberment component pays the employee a percentage amount based on a scheduled loss of use. There is a 1-year waiting period from date of incident, and you can find that scheduled loss of use in your employee booklet. And please note that naming a person as your beneficiary, they receive the full amount tax-free. Your benefit has a policy called critical illness. It will pay the employee the covered amount in the event that the employee becomes ill from one of the 23 listed illnesses under the plan. Examples include, but are not limited to, heart attack, cancer, stroke. Please refer to your employee booklet for further details. As an employee, your employer is providing you with disability benefits. This wage replacement is there in the event that you cannot work due to illness or injury that took place off the job. Short-term disability is a percentage of your weekly salary up to a maximum. Your short-term disability is there for you for the first 17 weeks, but if you are still unable to return to work, you could then transition to long-term disability. Long-term disability is a percentage of your monthly salary to a maximum. Your policy also includes dependent life insurance. This covers your dependents. Regardless of whether you cover them for health or dental, you should include them under dependent life. Dependent children are covered up to age 22 and then 26 if they are a full-time student. A spouse is either the person you are married to or in a common law relationship with. In the case of common law, you must be living on a permanent basis for at least 1 year prior to them being eligible for the plan. Dependent life claims are paid to the employee. No other beneficiary can be assigned. Extended health care benefits cover you and your eligible dependents. The coverage is broad, and although it may not cover every expense you encounter, here is a list of the typical expenses. Important to note that your prescriptions are set up to cover lowest cost generic equivalent, with the brand name medications covered only if the physician specifies no generic substitutions. Your dispensing fee maximum is set at $9 per prescription, and you have a formulary for those high-cost specialty medications. We are happy to have included in your plan medical travel benefits so that you don't need to purchase coverage when traveling unless you feel extra coverage is necessary. Your emergency out-of-country medical is $5 million per person per trip for up to 180 days. Keep in mind it is intended for first incident. Example, if you fall down and break a leg, you call the emergency out-of-country number. They will direct you to a closest hospital where they have direct billing agreement with, thus ensuring that you are not out of pocket for any expenses during your medical care. Now, if you are released and decide to stay on vacation and then have another medical incident, provided it is not related to the first incident, you still have medical coverage. Again, you would just call the emergency out-of-country medical number, a new case is opened, and you are sent off for treatment. However, if the second call for treatment relates to your first incident, you would likely not have coverage. It is important to remember this policy, like most standard medical travel policies, is intended for medical emergencies and not follow-up appointments. The expectation is once you are released from care, you go home to your home country for medical follow-ups. Trip cancellation. This is a unique benefit that we provide to our clients and not standard coverage in a group policy. Coverage is $5,000 per person per trip. It is intended for unforeseen events. Supporting documentation will be required. For further details on the policy criteria, please refer to your employee booklet for more information. In-province medical travel. This is intended to help assist with expenses incurred as a result of having to travel to see a specialist. Travel expenses can be eligible provided the travel is 500 kilometers or more round trip. Where transportation has been provided, please note that accommodations and meals for the patient and any required attendant, both before and after treatment, are limited to a maximum of $70 per day for a total of 7 days. Dental benefits are there to cover you and your eligible dependents. Basic services are those covering diagnostic, preventative, or most minor restorative procedures. Major services are those covering most major restorative procedures like bridges or dentures. Orthodontic services are the application of braces and are intended for dependent children up to age 19 only. Life is about adventure, exciting changes, happy experiences, family, and friends. But it can also bring tough challenges, stresses, and pressure. So it's important to know that you are not alone. The support is available through LifeWorks, a comprehensive employee and family assistance program. LifeWorks offers confidential support and services for work, family, life, health, money, and everything in between at no cost to you. The program includes 24/7 consultation, information, and resources, access to counseling by video, phone, chat, or in person, community referrals, and a secure desktop website and mobile app. Support and services are available by calling in or accessing the online support 24 hours a day, 365 days a year. The website is broken into 5 main categories: life, work, health, family, and finances. LifeWorks has resources online for every preference: podcasts, articles, assessments. Their toolkits bring together various resources in one easy-to-find location based on your topic of choice. LifeWorks is not your standard employee assistance service. So in addition to the website resources, they do research, can refer you to community programs. Imagine you or someone you loved has recently been diagnosed with cancer. LifeWorks can find the right support services needed at the time. Support groups, nutritionists, agencies that deliver meals, and other local organizations who are there. And then, of course, they have the referral to professional lawyers. Speak to a lawyer for up to 30 minutes at no cost and up to a 25% discount off the services beyond the initial consultation. Although LifeWorks program offers so much more than just counseling, it is still one of the most important elements of the program. Available 24/7 counseling by phone to address those immediate needs. With the solution-focused short-term counseling model used, the number of sessions varies and is determined on a case-by-case basis. With specialized counselors, you'll always have the right counselor for your situation. A variety of modes to suit clinical needs and individual preferences. So by phone, in person, virtual group, or a video chat. All counselors have a minimum 5 years clinical counseling experience and a master's degree. LifeWorks wants you to know that you do not have to be in crisis to use the service. In fact, they encourage users to access the program in a proactive manner. There are resources for everyone to use to support change, challenges, personal goals you may be experiencing in your daily lives. LifeWorks is there. You can contact us toll-free at 1-866-331-6851, or you can log in using lifeworks.com, username health, password support. As part of your extended health, you and your dependents have access to Akira virtual healthcare. 50% of primary care concerns seen in a doctor's office can be addressed through Akira virtual healthcare app and website. Confidential medical consultation by video conference. Access to medical care without the need to use valuable sick days or personal time off for doctor's visits. Save time and reduce the inconvenience for routine medical interactions like refilling prescriptions. Akira's continuity of care approach provided by consistent treatment across multiple sessions. For more detailed information on your benefits, please refer to your employee booklet. My Group Health is your claims payer. Here I will explain how to submit claims and understand what is required to avoid those unnecessary claim declines. There are 4 methods to submit your claims. Manual, using the mail by mailing in your claim form and receipts. The online website, using My Group Health website on your computer or tablet. The app, using a smartphone, you can download the My Group Health app. Please ensure that you have set up your account on the website first. And then finally, direct billing. This option is available if the service provider you are using does direct bill. Please ask your service provider at time of service. Logging into the My Group Health app will provide you with all the necessary information you need. Under My Claims, you'll have access to the claims you've submitted, managing your banking info, view any claims history, and print forms. Under the My Benefits, you'll have access to your coverage information, the list of dependents, your benefit card, and more. The app provides easy and quick access to the wallet card or travel card simply by going into the app. You will only have to log in if you are submitting claims or accessing other online information. There are a few terms used in group benefits that I have found over the years to be helpful for members in understanding how claims are adjudicated and why they are paid the way they are. The first is coinsurance. The portion the insurer pays, anything less than 100% means you pay the difference. Coordination of benefits, or COB. It means that you have coverage under your plan and also under a second plan, usually your spouse's. There is an order in how claims should be processed when multiple plans are involved. The employee should submit to their company plan first, referred to as first payer, and then amounts not covered can be submitted to the second plan, known as second payer. Your spouse should submit to their company plan first, and amounts not covered can be submitted to your plan. Your dependent children will submit to the plan whose parent has the first birthday in the calendar year. Example, Dad's birthday is in February and Mom's is in July. Dad's plan is first payer and Mom's would be second payer. Claims not submitted in this order can cause delays or declines in payment. If you experience any difficulties, please contact your claims payer, but most importantly, if your spouse's plan information changes at all, please update your employer immediately to avoid future claim issues. Now, maximums on a plan are set for each benefit by calendar year or rolling calendar. A calendar year is when a new balance is reset on the first, regardless of the amount that you used in the previous year. You will see it appear in your booklet as per year. Examples are paramedicals, like a chiropractor or massage therapist. Rolling calendar benefits have maximums that are date-based and are renewed based on the last date you used it. It will appear in your booklet as months. For example, vision might show 24 months. So if you use all of your vision on March 23rd of 2020, you won't have access to your vision benefit again for exactly 24 months, March 24th of 2022. Covered expenses is based on the term called reasonable and customary and is used to describe the average cost of a product or service. These costs are set differently depending on the benefit itself. For example, prescriptions. Each medication will have a reasonable and customary amount per pill, and it is set by the formulary of the plan in place. And your dental fees are set by the Provincial Dental Fee Guide for each procedure. The claims payer is responsible to pay for the benefit up to its reasonable and customary cost at the applicable co-insurance rate. Finally, pre-approvals. We recommend that for any eligible claims over $500 that you get a pre-approval from your claims payer. Specifically, with dental claims, ask the dentist to submit on your behalf and note that that pre-approval comes back to you either in your mail or online and not to the dentist office. Claims related to medical equipment, whether purchasing outright or getting pre-approved, the claim must include make and model numbers of the equipment you are getting. It is this information that tells the claims payer what the reasonable and customary cost is for that piece of equipment. Any orthotic claims should include a gait analysis. This will show the claims payer what materials and work went into the making of your orthotic, thus helping them determine the reasonable and customary cost. If applicable, your company may provide you with a healthcare spending account. This is an individual employee account that provides reimbursement for eligible health and dental care expenses not already covered by the province through MSP or through your group benefits plan. You should always submit your expenses to your group benefits plan first, and those not paid can be submitted to your health care spending account. When submitting unpaid expenses, it is important to include the explanation of benefits from your group insurance plan, as this confirms what amount was not already paid and therefore eligible under your health care spending account. Up to now, we have discussed the benefits available to you through your group benefit plan. Plus, we've given you important understanding of how claims are adjudicated. What we are about to discuss is optional benefits. You can choose to add these benefits as additional coverage by enrolling in the applicable benefit and your employer taking the premiums through payroll deduction. Optional benefits can be applied for at any time. However, some do have some specific limitations to note. With all optional benefits, the original form with the employee and/or spousal signatures are required by group health. First is optional life. The benefit is available to employees, spouse, and you can add dependent children under a child rider if the employee is applying for coverage. The nice thing about optional life is the first $50,000 you apply for has no medical requirements, referred to as guaranteed issue. Any amount above $50,000 that you apply for does require medical evidence to be submitted and is subject to the insurer's approval. In the table shown, the monthly rates are based on $50,000. Please note it is only under the guaranteed issue that you cannot be declined for coverage. The second is optional critical illness. This benefit again is available to employees, spouses, and you can add dependent children under the child rider when the employee is applying. The difference when applying for optional critical illness versus the optional life is the guaranteed issue or no medical requirements on the first $50,000 does have a limited window in which it applies. So for the first 30 days that you are covered on the group benefit plan, you can apply for up to $50,000 of optional critical illness and not have to submit medical evidence. However, if you are applying after 30 days of being on the group benefit plan, you must submit medical evidence on any dollar amounts applied for. The table shown is the monthly rates based on $50,000. Again, it is only under the guaranteed issue clause that you cannot be declined for coverage. Lastly, optional accident and serious illness, also ASI. This benefit includes accidental death and dismemberment coverage, plus it includes a critical disease and serious illness benefit. Critical disease and serious illness pay out 10% of your accident and serious illness amount up to maximums. The benefit is available as either single, so employee only, or family, and then all members covered under your group benefit plan are included. The nice thing about the optional accident and serious illness is no medical evidence required on any amount that you apply for. For more information on any of the optional coverages mentioned, please contact your plan administrator at your company for details and a copy of the application form. Questions regarding coverage or eligibility for coverage should be directed to your plan administrator or supervisor at work. Any questions regarding claims, how to set up your account, how to submit claims, or when you should expect payment, these can be directed to your claims payer, My Group Health. You can contact them at 1-833-344-6944 or email them at askus@mygrouphealth.ca. If you still have questions or need further assistance, please reach out to our office and your account manager or another colleague would be more than happy to assist. Thank you again for your time, and we hope this has been helpful.